listener production.
Hi, Natarsha Belling with you and welcome to the afternoon edition of The Briefing. Coming up in our deep dive, why the nation's top doctors and midwives want to crack down on the dangerous and sometimes deadly practices in so-called free births. Experts say mothers seeking births outside hospitals are certainly not to blame, but the support workers who are not medically qualified or trained who are putting the lives of the mother and baby at risk. But first, let's check the afternoon headlines this Thursday, the 6th of November. Investigations are continuing after a deadly house fire that's claimed 4 lives in central Queensland. 4 people, believed to be a man and 3 children, were found dead after emergency services were called to the property in Emerald just before 7 a.m. this morning. Here is Queensland Premier David Crisafulli.
On behalf of everyone, I really want to express my deepest sympathies to the family, but also to the neighbours and the emergency services involved. This is an incredible tragedy,
Tasmanian police are expected to seek a warrant for Bruce Lurman's arrest after he failed to appear in court today over an alleged vehicle theft. Lurman is accused of taking a Toyota Prado in November last year. He's pleaded not guilty to the charge. The case was listed for a contest mention, but when Lurman's name was called, he was nowhere to be found. Given his non-appearance, police said they would apply for a warrant for his arrest. And One Nation leader Pauline Hanson has lashed out at the federal government while speaking at a Conservative conference at Mar-a-Lago in Florida. Ms Hanson has missed parliamentary sittings here in Australia and has been staying at President Trump's resort. She was the only Australian invited to speak at the forum. Ms Hanson said, quote, "It was refreshing to stand in a room where common sense still matters, where strong borders, national pride, energy independence and putting your own people first aren't dirty words, they're priorities." The One Nation leader also praised President Trump, saying under his leadership, America is turning itself around, adding back home, Australia is heading in the opposite direction. It comes as her party records record highs in the latest polling in Australia. Now it's time for our deep dive on free births. A growing number of women are choosing to give birth at home, but there's been a concerning increase in the deaths and complications associated with free births, which is the intentional practice of giving birth without a registered healthcare professional present. Experts are calling for tighter regulations around free births to ensure mothers-to-be are not misled about the risks and can make informed decisions about the best ways to give birth safely. Joining us is President of the Royal Australian and New Zealand College of Obstetricians and Gynecologists, Dr. Nisha Khot. Doctor, thanks so much for joining us. Your organisation, along with the Midwives Association, is calling on health ministers right across the country to end free birth deaths. Can you explain that?
Yes, what we're calling for the health ministers across Australia to do is to put in place legislation that actually protects women from other professionals who are not qualified to provide clinical care in the birth setting. So we are not calling for free births to end because I think it is very important for women to have autonomy of choice about how and where they birth. That is absolutely a woman's right. We're also not calling for legislation against people who provide really important emotional support to women during labor, during pregnancy and after birth. They call themselves doulas or various other names like birth keepers. It's very important for women to have that emotional support. What we're calling for an end to is where people who don't have clinical qualifications or healthcare qualifications veer into the territory of providing healthcare. I think that is incredibly dangerous. That is what puts women's lives and babies' lives at risk.
We have seen recently an increase in complications or in some circumstances deaths from women or people that choose to have home births or free births. What do you think we can do to, apart from the legislation, prevent that? Because you're right in the concept of it's incredibly important women have that choice, but they need to be informed about what possible risks may be involved.
I think, first of all, it's really important to acknowledge that a large proportion of women who make the choice to have a free birth are doing so because they are disillusioned with the maternity system as it is. Some have had traumatic experiences themselves, or they have heard from friends and family about experiences that have been suboptimal. And so I think the first onus is on us to provide women with respectful, supportive healthcare when they come to see us in the hospital system. The other thing is that we should make the difference between home births, where there is a qualified midwife present, versus free births, where there isn't a qualified healthcare professional present. The home births that happen in Australia are very safe because they happen within a certain group of regulations, if you like. So midwives have signed up to provide the home birth service. They have qualified, they have trained. There is a local public hospital available where women, if they need to be transferred, can go in and will be welcomed when they come there. And so that sort of home birth service is something that absolutely the College of ONG supports, the College of Midwifery supports. So it's important to recognize that there are a few things that we should be doing so that women don't have to make this choice of birthing at home without a healthcare professional present.
What are some of those things that we could do? Do you mean as in the medical professionals?
Medical and midwifery professionals could do, yes, absolutely. We could provide that respectful care to women when they come into hospital. Funding is another important issue. If we had better funding of maternity services, that would mean we would have more healthcare professionals present. We'd be able to provide that care. Women really value a continuity of care. They value being able to see the same midwife and the same doctor throughout their pregnancy care. And again, putting some funding behind providing continuity of care is also something that we should definitely do so that we give women the experience that they want.
So I'm glad you've clarified the difference there, Doctor, between free birth and home birth. So can I just clarify, a free birth is no qualified medical professional present at the birth, and a free birth is a birthing experience where there are no qualified professionals there, just a support person.
Absolutely. Yes, that is the difference. A home birth is where there is a qualified person present. That's usually a qualified midwife. But a free birth is where there is no qualified midwife present at the birth.
I'm glad you've also mentioned there, Doctor, that in some circumstances, women choose this at-home experience because of past traumatic experiences they may have had with other medical professionals or in hospital. So do you know of circumstances where there have been a support or has been a support person that has lied or misled that family saying, I am qualified to support you, when they're actually not medically qualified to support that person if something goes wrong during the birth?
I have certainly heard of, people who sell themselves, if you like, or advertise their services as being qualified to manage complications if they happen in the home. And these are not people who are qualified. They don't have a medical qualification. They don't have a midwifery qualification. So they cannot provide that care. They don't have access to the medications, for example, that would prevent bleeding. So if you don't have access to the medications and you don't have the qualification to be able to give the medication, you're not going to be able to control the bleeding when it happens in a home setting. Whereas if you had a midwife that was present, that midwife would have the qualifications and also have the medication readily available so she could give it to you to stop it. That's where the difference comes in. And I think it's really important that we hold people to account when they misrepresent their abilities and their qualifications or lack of qualifications.
So in regards to this legislation, Doctor, if this is adopted by health professionals and different governments across different state and territories, or even the federal government, how do you enforce this? So are you going to target the people that are misleading the women that give birth, and then if they're found to be negligent or misleading, that those people get prosecuted?
Yes, that's exactly what we're saying, that when people are misleading women, to say to women that they can provide care that clearly they are not qualified to provide because they are not midwives or doctors, then they should be held accountable by way of either prosecution through the legal system, whether that includes fines, whether that actually includes sentencing via prison terms. I would leave that to the legal experts, but certainly they should be held accountable.
How important is it that we shine a light on These people that are being very deceptive and, as we know, in some circumstances, are seriously putting at risk the lives of not only the unborn babies, but also the mothers.
It is very important we do this. Ultimately, women can only make choices for their care if they know the data surrounding safety of themselves and their babies. Right now, we don't have data that we can share with women to say, here's 1,000 free births, for example, that happened in Australia, of which these are the numbers that, there were complications with. If we don't have the data, then we can't share it with women. So women are reliant on whatever information they're getting from the person who's selling themselves as providing that service. I think that's disingenuous. I think we should give women the data for them to make their own decisions. And despite having the data, women might make the decision to continue to have a free birth. And that is absolutely fine, not a problem at all. But when you make those decisions without the information, then you're kind of going into it blind.
What would your advice be to pregnant women or families that want to engage in these free births or also, I guess, in home births? That we live in a wonderful world today where very rarely there are complications, but giving birth to a child actually can be incredibly dangerous and things can deteriorate very quickly.
I would say to women who are planning a home birth, first of all, to find out whether there are local publicly available home birth services that they may be eligible for, which will then provide them with the safety net. If there isn't a publicly available home birth service, they might need to access a private midwife, which does come with cost implications. So I would encourage them to find a professional who is able to provide them with a home birth service with safety. If they're planning to have a free birth instead, I would strongly encourage them to have a conversation with the midwife or with a doctor locally to understand what the risks are and what they might be able to do to mitigate those risks as far as possible. Ultimately, this is a decision that women make. We are here to support women. I know that the vast majority of maternity units will welcome women, even if they have made a decision to free birth and at the last minute they change their mind and decide to go into hospital. They will always be welcomed into all health services.
It's such an important conversation, and we really appreciate you joining us today to unpack this and really put the focus on making sure that women are safe.
Thank you very much for having this conversation.
That was Dr. Nisha Khot, the president of the Royal Australian and New Zealand College of Obstetricians and Gynecologists. And that's it for this episode of the afternoon edition of The Briefing. We'd love you to subscribe or follow us on Instagram at The Briefing Podcast. I'm Natarsha Belling. Thanks for your company.